Welcome to our presentation on neuromuscular and neurodegenerative disorders. In this session, we will explore a range of conditions affecting the nervous system and muscles, from disorders impacting muscle movement to those affecting cognitive function. Join us as we look into the intricacies of these conditions, their symptoms, diagnostic methods, and current treatment approaches. Amyotrophic lateral sclerosis, ALS, commonly known as Lou Gehrig's disease, is a progressive neurodegenerative disorder affecting both the upper and lower motor neurons. This leads to a gradual deterioration of muscle control and function over time. Diagnostic tests for ALS often reveal elevated levels of creatine kinase, CK, in laboratory evaluations, while nerve conduction studies typically remain within normal range. As the disease advances, individuals with ALS frequently experience respiratory failure, which is the primary cause of death. Non-invasive ventilation techniques are commonly employed to manage respiratory complications. While there is currently no cure for ALS, treatment strategies aim to enhance the quality of life for patients through various therapies, including physical, speech, and occupational therapy. Additionally, the medication riluzole has shown some efficacy in modestly prolonging lifespan for individuals with ALS. Myasthenia gravis is an autoimmune neuromuscular disorder characterized by the body's production of antibodies that target and destroy nicotinic acetylcholine receptors located at the neuromuscular junction. Individuals with myasthenia gravis often experience muscle weakness and fatigue, particularly affecting muscles involved in eye movement, facial expression, and respiration. Diagnosis typically involves specialized tests such as repetitive nerve stimulation and the identification of a thymoma, a tumor of the thymus gland. Treatment for myasthenia gravis focuses on enhancing neuromuscular transmission, suppressing the autoimmune response, and managing associated symptoms. Common therapeutic approaches include the use of acetylcholinesterase inhibitors, immunosuppressive medications, and plasmapheresis, a procedure to remove harmful antibodies from the blood. Lambert-Eaton myasthenic syndrome is an autoimmune neuromuscular disorder often associated with small cell lung cancer, frequently manifesting as a paraneoplastic syndrome. In Lambert-Eaton myasthenic syndrome, the immune system produces autoantibodies that target presynaptic voltage-gated calcium channels situated at the neuromuscular junction. This results in impaired release of acetylcholine, the neurotransmitter responsible for muscle contraction, leading to muscle weakness and fatigue. While treatments akin to those used for myasthenia gravis may be employed, they often exhibit lower efficacy in Lambert-Eaton myasthenic syndrome. The primary focus of management lies in addressing the underlying cancer, as successful treatment of the cancer can induce remission of symptoms. Guillain-Barré syndrome, GBS, is characterized by acute autoimmune polyneuropathy, resulting in a rapid, progressive, and ascending paralysis. The paralysis often initiates in the lower extremities and ascends upwards, potentially impacting the respiratory muscles and precipitating respiratory failure. GBS diagnosis relies on cerebrospinal fluid analysis, which typically reveals elevated protein levels alongside a normal cell count, in addition to nerve conduction studies. Optic neuritis, characterized by inflammation of the optic nerve, frequently manifests as a symptom of multiple sclerosis, MS. MS is an autoimmune inflammatory disorder that results in the deterioration of the myelin sheath enveloping neurons, leading to a diverse array of neurological symptoms. Many individuals with MS undergo a relapsing-remitting course marked by periods of symptom aggravation succeeded by periods of remission. Diagnosing MS typically involves an amalgamation of clinical observations, MRI imaging, and the identification of oligoclonal bands in the cerebrospinal fluid. Tuberous sclerosis is a genetic disorder distinguished by the formation of non-cancerous growths, termed hamartomas, in the brain and other bodily organs. These growths can provoke an array of neuropsychiatric symptoms such as mood fluctuations, behavioral challenges, and delays in development. Seizures represent a prevalent symptom of tuberous sclerosis, frequently arising from the presence of these cerebral lesions. Sturge-Weber syndrome is marked by a unique port wine stain, or nevus flammeus, a skin discoloration resulting from an abnormality in the capillaries beneath the surface. Diagnostic imaging, such as a CT scan, may uncover tram tract calcifications in the brain, a characteristic indication of Sturge-Weber syndrome. Additionally, individuals with this syndrome are prone to developing glaucoma, a condition that, if left untreated, can result in vision impairment. Huntington's disease is an autosomal dominant genetic disorder distinguished by an abnormal number of CAG trinucleotide repeats in the Huntington gene. This condition is a movement disorder marked by distinctive choreiform, jerky, involuntary movements, as opposed to the bradykinesia observed in Parkinson's disease. Beyond the movement abnormalities, Huntington's disease frequently manifests with an array of neuropsychiatric symptoms, such as personality alterations, mood disturbances, and cognitive decline. Myasthenia gravis is characterized by autoantibodies targeting the postsynaptic nicotinic acetylcholine receptors at the neuromuscular junction, resulting in muscle weakness and fatigue. Conversely, Lambert-Eaton myasthenic syndrome involves autoantibodies directed against the presynaptic voltage-gated calcium channels, leading to impaired acetylcholine release and subsequent muscle weakness. Treatment strategies for both conditions typically involve a combination of acetylcholinesterase inhibitors, immunosuppressants, and therapies aimed at removing or binding circulating autoantibodies. Neurodegenerative disorders encompass a spectrum of conditions affecting the nervous system. Amyotrophic lateral sclerosis, ALS, or Lou Gehrig's disease, impacts both upper and lower motor neurons, resulting in progressive muscle weakness and eventual respiratory failure. Huntington's disease, an autosomal dominant genetic disorder, manifests with choreiform movements, neuropsychiatric symptoms, and cognitive impairments. Multiple sclerosis, MS, is an autoimmune demyelinating disease that presents with various neurological symptoms such as optic neuritis, sensory disturbances, and motor dysfunction. The neuromuscular and neurodegenerative disorders covered in this presentation illustrate a broad spectrum of conditions, each with distinct pathophysiology, clinical features, and treatment strategies. Despite the absence of definitive cures for certain disorders like ALS and Huntington's disease, ongoing research and medical advancements offer hope for improved understanding and potential therapeutic interventions. Healthcare professionals play a vital role in diagnosing, managing, and supporting patients and their families impacted by these challenging neurological conditions. A comprehensive grasp of these disorders is essential for providing optimal care and guidance.